Hello everyone and happy Friday. Welcome back to my channel. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. It is time now for the Friday edition of the Virus Update for Friday, December 5th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Why? Because, well, no one wants to be sick. No one has time for that. We have lives to live and, well, sometimes sickness gets in the way, and it's been getting in the way a lot over the past several years. So you need to be informed of what's going on with these viruses. If you're new here, subscribe down below. If you like today's video, hey, click that thumbs up button and give it a thumbs up by like button down below. And of course, share this video with anyone you know and leave anything that triggers a thought in the comments section down below. Already, we have a ton of things to get through today, including some data, some news, CDC data, UK data, data from New York State. Yeah, we have a lot of things to get through today, so let's get right into it, shall we? Starting off with this from Sci-Fi. You see me show this account before. This is in California we're going to talk about here with wastewater. California reports 26% of wastewater sites have increased SARS-2. In other words, COVID versus 3 weeks earlier, with the Central Valley region up over 250%. Yeah, things are starting to change. We're not seeing that downtrend anymore. We're starting to see more places show an uptrend in California. 29% of sites still decreased, and the rest are flat or have concentrations too low for trend to call. But overall, we're starting to see more sites beginning to show increases for COVID there in California. But you know what? Despite all that bad, there is still some good. Southern California, Los Angeles, and Greater Sacramento decreased the most first 3 weeks ago. Central and Northern California see the most sites with increases, and sites are shown below. So Southern California and Los Angeles still somewhat okay for this time, but even there, I think things are going to start to change relatively soon. All right, let's go international for a little bit. We have several things, starting off with this from Dennis the COVID Info Guy. Western Australia weekly COVID update, week ending November 30th, 2025. Remember, a lot of data we will look at today and other times here on channel is often lagged data. Maybe it's a week or two behind, 5 to 10 days, 14 days behind. That's just the way it works with data. So oftentimes the reality of what we're seeing is the reality of several days ago. And in this case, not good news. COVID positivity rate over in Western Australia is 1.3%. That's down by 0.5%. But PCR cases, 92. Hey, that's up by 43.7%. Hospitalization average case remains stable at 17 per day. ICU average, 0. So that's some good news there. Then we go to South Australia weekly respiratory update, November 29th to December 5th. So this is a little bit more up to date. Reported cases. Hey, good news here. COVID, 144. That's down by 5.2%. Flu, 773. That's down by 3.4%. RSV, 77. That's down by 2.5%. Pertussis, bad news here. 66 cases. That's up by 15.7%. Reported deaths in 2025. COVID, 78. Flu, 61. RSV, 12. And pertussis, 5 at this time. Now, taking a look at this. This is where the good news ends. Yeah, this is not good. Australian Respiratory Surveillance Report, November 30th, 2025. In the last 3 months, in the last month, I should say, November 3rd to November 30th, 2025, this clearly shows that they had an extended winter virus season that really extended itself in the spring, and I do understand now is summer. This was the end of spring there, where COVID, they had 7,515 cases. It was up by 15.6% in November. Influenza, 35,006 cases. That was up by 26.1%. RSV, 5,325 cases. That was down by 20.1%. We can only hope December will end up being down. We'll have to see here. We are starting to see some regions there go down. We're still seeing, I think, Queensland, was it New South Wales? I think one of them was still rising. So, yeah, not good. All right, moving on to Korea now. We're still with Dennis, the COVID Info Guy. Korea COVID-19 hospitalizations among elderly outpace flu cases. Korea Disease Control and Prevention Agency warns 61% of COVID hospitalizations are 65 and older, meaning seniors make up 6 in 10 cases this year, remains a bigger threat to older adults than flu. So see, COVID can still be more serious than flu, and 61% are in 65 or older, but the other 49% are all the other age groups, so that's just going to show you any age can be hospitalized with COVID. Moving on now to Scotland. Flu cases in Scotland more than double as hospital admissions surge by 70%. An influenza mutation of the H3N2 strain, known for causing severe illness, is dominating across Scotland, and I believe that subclade K is probably playing a role as well. Hospital admissions surged by 70%. Confirmed cases more than double. Cases reach very high level in 5 to 14 age group. Yeah, that age group is having some real problems. You're going to see more about that in just a moment. 7 deaths registered with flu as underlying cause. Hospital admissions rose from 426 to 724 between November 24th to the 30th, while laboratory confirmed flu cases rose from 845 to 1,759, Public Health Scotland figures show. So, yeah, that's not good. And those age 65 and over make up around 40% of all hospital admissions, with those age 75 and over representing the highest proportion. Now let's just go to the UK update. See here, measles looks to be doing okay. We'll maybe look at that over the weekend. We got too many other things to look at. Influenza. Yeah, there was a little pause, and now influenza is starting to go up, and this is where I'm really concerned. Virus test positivity rate. Okay, over all the age groups is 12.7%. But then we come over here to this, and I actually posted this on X, Blue Sky, and I believe on the Facebook page, Data Report as well. Ages 5 to 14, that's this green line right here, 5 to 14 years old. 36.25% of those cases are coming back positive. Over 36% of cases of tests in the age groups from 5 to 14 years old are coming back positive. That is a significant number of children testing positive for flu at this time. That means that age group is getting hit really hard. You know, schools, I'm hearing that emergency departments are getting hit hard over there as well. And then we also have, let's see, which age group is this? 15 to 44 years old. 20.88%, almost 21% of those tests are now coming back positive as well. So you get the idea here. And you're probably thinking, oh, well, it's just people testing positive. They're not going to the hospital. Wrong. Hospital admission rates are starting to go up among the age groups as well. Almost all age groups are starting to see an increase in hospital admissions. 4.04 per 100,000 people are being admitted at this time when it comes to flu. So that's not good. All right, moving on now. Let's go to RSV. Again, this data it says November 24th. That's actually the new update, I believe. And RSV positivity rate, 9.96%, almost 10% of RSV tests are coming back positive. And then we come to this. I did not post this on X. Matter of fact, I'm just noticing this now. Whoa, this is not good. Hospital admissions rate, excluding intensive care units and high dependency units per 100,000 people by age. Age group, this blue line, 0 to 14 years old. You notice I'm pausing here. 44.62. That is really bad. So, yeah, 0 to 4 years old, doing really bad in the UK right now. And of course, when it comes to flu, 5 to 14 years old, doing really bad. This is a horrible indicator of what's about to happen or what may be starting to happen here in the United States. Yikes. That's just not good whatsoever. All right, moving on. We have many more things to get to. New York State Health Commissioner says that in 2024, 3 times as many New Yorkers died from COVID than flu. Nearly 3,000 to roughly 700. 3,000 COVID deaths versus 700 flu deaths. Yikes. Hey, did anyone know that New York State still had 3,000 COVID deaths in 2024 when you were told, oh, the pandemic's over. Get on with your lives. This is my time to remind you, and does my comment even show up here? Yeah, I left him a comment. Anywho, COVID deaths, 3,000 That's on top of flu deaths. That's on top of colds, pneumonia, RSV, and any other respiratory virus that causes a death or any other virus causing a death. Yes, these are additional deaths on top of heart attacks, strokes, all those things. These are additional deaths. This is deaths that were not happening prior to 2020. Okay, maybe the first COVID death was in 2019, late 2009. We just didn't know about it. It's very well possible. The point is, these are increased deaths. Why are the funeral directors and funeral homes not acknowledging that their business is busier? Why are they not raising red flags? Because when I go to check obituaries on funeral websites, it's not a thing I do often, but sometimes you do because maybe someone you know passed away and you're trying to find out, hey, is this where the I'm noticing that there are way more funerals at some of these local funeral homes. I've seen more funeral processions now than I did pre-COVID, so you get the point here. Someone needs to raise a flag and say, hey, wait a second here. Something's not right here. Maybe we need to investigate on what is going on. I don't know. We did forget to do the UK when it comes to COVID. We'll get to that on Sunday. All right, moving on now to this. 8 new measles cases have been reported in South Carolina. The outbreak continues to grow. The total number of cases is now up to 87. And moving on to this, you may have been following this case. You may not have been following this case. The Luigi Mangione case has been postponed due to illness. In case you did not know, he is accused of killing United Healthcare CEO Brian Thompson. And now this case is pretty much been put on pause until, well, early next week. I believe they're going to go at it again on Monday because of, quote, some illness. I don't know what the illness is. Very rare do we ever find out what these illnesses actually are. I've added some things to the sports illness page, and I don't think we have any results as to what they are as well. One just says, oh, upper respiratory virus, but doesn't say what the actual virus is, or upper respiratory illness, I should say. You can check that out on my website, datareport.info, where we do have a bunch of tracking threads and a whole bunch of other things. Look at this. A UK school sees 170 students out sick in a single day. Well, you saw the positivity rate for those ages are not doing too well when it comes to flu right now. I was posted by Steve. If you want to see that full story, go over to the website, datareport.info. All right, where are we moving to next? Let's take a look at what's going on with air qualities in the United States, shall we? And while we're waiting for that, let's pause and take a hydration break while we're waiting for that to refresh. Water is a drink of choice today. First off, on the West Coast, we can see air qualities are still bad. That does include parts of Southwest Canada and east of the Mississippi. From the Central Plains right on up into the Great Lakes and even portions of the Mid-Atlantic, we are seeing some bad air qualities today. So air quality is not great in many parts of the country. Taking a look at what's going on in Pinellas County, Florida, wow. We see a ton of ambulance calls there today. That is not good to see whatsoever. Taking a look at what's going on in Maryland, and we do see some hospitals are dealing with problems, but really not terrible today. Yeah, there are some fours, but we do see a lot of ones. Ones meaning not very busy in the emergency departments. Taking a look at what is going on in Philadelphia, and we need to go to the numbers from, let's see, we need to take a look at Wednesday and Thursday. Wednesday, 773 EMS incidents, and Thursday had 775 EMS incidents. Taking a live look at what's going on in Montgomery County, Pennsylvania, not too bad. We do see a few calls there, but nothing that's just alarming at the moment. Taking a look at Chester County, Pennsylvania, which we do need to refresh. And we do see there are a few calls going on there. Sick person a few times, heart problems, and a few other things going on in that area. Taking a look at what's going on in Bucks County, Pennsylvania, and that shows us there are currently 9 calls going on there at this time. Now let's take a look at some hospital data, and we'll take a look at Pennsylvania and New Jersey like we normally would. And we do see there are a few hospitals in the yellow in southeast Pennsylvania. What's going on at Paoli? Well, that hospital is dealing with emergency department overcrowding. And taking a look at New Jersey, do we have any problems there today? And in New Jersey, we have Inspira Medical Center, Mannington, specialty issue. Penn Princeton Medical Center today is dealing with full and total divert for patient volume. It even says right there, emergency department, full divert. Yikes, that's not good. Taking a look at what's going on in New York State, and we do see some bad news here. things are starting to trend in the wrong direction. Well, hold on here. We had yesterday's report was revised upward. That did say 559, and yesterday was revised upward to 661 cases. Today is 493, so you get the point here. Things are starting to go upward in New York State, and it is very clear in the hospital admissions. 333 hospital admissions in that weekly update, which is much higher than the previous weeks, 292, and we suspect that number is only going to continue to go higher. Let's take a look at what's going on with New York State flu data if we can. We do need to refresh this. We'll see if it actually gives us an updated. Let's see here. We need to click on flu tracker, and let's see if that actually updated. It did. Wow. So in the most recent week, is this? Let's see. Well, it looks like they now have 14,506 cases of flu. Yikes. Yeah, that's these are cases by season. Let's go to current week cases. That's a lot of cases there. And you can see here, generally cases are starting to go upward. New York City, cases by region for the current week this year. Yeah, 8,034 cases of flu. And mind you, there's a lot of people that do not get tested, or they do the at-home test. So it's not counting all of those cases. Influenza type A, 13,418. Type B, 202. Influenza type not specified, 886 of the cases. Now taking a look at some new data from the CDC. As of December 2nd, 2025, they estimate that COVID-19 infections are growing or likely growing in 22 states, declining or likely declining in 7 states, and not changing in 16 states. Previous estimates can be found on their website. Anywho, you can clearly see here the Northeast is getting hit the hardest, as is portions of the Plains and the Great Lakes. Vermont is not changing this week. We do see Alaska is likely growing, and there is a state in the Southeast that is likely growing. That's Alabama. Still declining or likely declining on the West Coast. Mostly in the likely decline, unless you're in Arizona, where things are in the declining state at this time for COVID. Influenza continues to get bad across majority of the country. As of December 2nd, 2025, they estimate that influenza infections are growing or likely growing in 39 states. Declining or likely declining in 0 states. Yeah, 0. And not changing in 4 states, and then anywhere in white is just not estimated at this time. I don't think you need me to tell you what's going on here. You get the idea. Flu is about to get really bad. It's in the process of getting bad, as is RSV. As of December 2nd, 2025, they estimate that RSV infections are growing or likely growing in 38 states, declining in 0 and not changing in 0. Anything in white. Again, no data. And take a look at this. No region of the United States is spared right now. Yeah, maybe the mountainous region and just west of the plains, because there's no data. But if we had data there, it's probably likely growing or growing there as well. All right, moving on now to the latest flu view, I believe this is called. Well, influenza surveillance report. And we can see here that, take a look at this. High levels of influenza-like illness in Louisiana. Colorado is high. Puerto Rico is now high. New York State is now high. New York City is high. New Jersey is now up to the moderate phase. And that's not the only place. Idaho's also moderate as well. And we do have the upper end of low in Florida, Georgia, South Carolina, I believe also in Connecticut, maybe Rhode Island, and also up there in, where is this? Michigan. Let's see, can we get Rhode Island? Yeah, Rhode Island is low, but it's borderline going moderate in that area. And Hawaii is also borderline going moderate as well. So you can clearly see here, flu activity is picking up. All right, taking a look at what is going on with this. Yes, this is something we don't usually show. You know how Walgreens has that page where they talk about acute respiratory illness index, activity, whatever you want to call it? Well, in this case from the CDC, New York State is moderate, and Alabama is in the moderate category at this time. Now, we're coming down here to something else that we really do need to take a look at, and that is positivity rates. And when it comes to influenza, the positivity rate is now up to 7.1% in the United States. COVID-19 is 3.1%. Yeah, that's starting to go upward. And we also see that RSV at this time is 2.6%. And really, actually, I gotta correct myself. COVID, it's not going up that much. It's really RSV and influenza that is going up. Eventually, things will change for COVID and they will go up. We still don't know. Is it going to be BA 3.2, BA 3.2.2, or what is the next variant going to be? Subvariant of Omicron? We do not know that yet. Hopefully, we will get some answers soon. All right, ending today on this. I know, long video today. This is wastewater. COVID. It is still rising in the Midwest. It is still rising in the South. Dropped a little bit in the Northeast. And also, it looks like the West number, maybe that went up ever so slightly. Yeah, that went up ever so slightly. We'll look at a more detailed look at this maybe on Sunday. And that does it for today's virus update. If you enjoyed it, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave those comments down below. I will see everyone again tomorrow. I think we're doing an Out in the Wild video tomorrow. I'm not 100% sure. I think it's going to be out in the wild. Until I see you again tomorrow, stay safe, everyone. And, of course, have a fantastic Friday afternoon. Thanks for watching.